A lot of patients that come see us, we're not their only consult, right? This is a huge procedure, and I don't expect someone to go one place and pick an office immediately. They're going to multiple offices and they're questioning to themselves, how do I pick the right dentist, right? How do I know between all these people I'm seeing, kind of what is the best option? And there's a couple things that I think you should look for. So the first thing is, do they do everything all in one place? A lot of times the dentist you might see might send you to a surgeon to get something done and then send you to a different dentist to get the teeth put in. The problem with that is you're bouncing around multiple offices, multiple different teams. You don't get that kind of close approach with a team. And the other side of it is kind of who's in charge, right? You know, the dentist is placing the implants, but then a different surgeon in a whole different office is doing something else. Having everything in one office be completely cohesive makes the process smoother, makes the process quicker, make sure there's less hiccups for that patient. So I think that's extremely important when a patient's looking for a place to go. The other thing to ask is, you know, are they on the forefront of technology? There's a lot of dentists out there who still kind of do things in an old-fashioned way where they put you in a denture for 6 months before you even get teeth. You don't get healing teeth that are screwed in, or maybe your healing teeth are just a denture that has some holes drilled in it and it's attached but it's not as strong, right? You want to make sure that the office you're going to has all the up-to-date technology they can and is staying on the forefront of that. Here at New Smile Columbus, we have 3D printers, we have scanners, multiple different kinds of scanners, we have 3D x-rays. We do everything possible to have technology so that, you know, it's as seamless as possible, but also the patient's getting the best result as possible, right? So I think that's super important when choosing a dentist who to go to, is making sure that they're keeping up to date on all that. And then the other thing is, you know, make sure you're comfortable in that office. A lot of times offices are really big and there's a ton of moving parts. It's not necessarily bad, but in a lot of these big, giant corporate offices, like, you're kind of getting shuffled through the process. There's not really a close personal touch. You might not even know who your doctor is. Just make sure you're comfortable. This is a relationship that you're gonna have with this office for a significant period of time, and then even when you're done, you're gonna have a continued relationship with that office. That office is gonna be kind of your close friend as you go through this process and beyond. So make sure you're comfortable, make sure you're happy in that office, and make sure you like the people there. A big question we get here a lot is, will I have teeth throughout this process? Am I gonna have to go without teeth? Am I gonna have to wear dentures? And here at New Smile, our goal is that every patient that gets surgery, our goal is to get them in teeth within a day or the next day. We want patients, once they're done with their surgery, to have teeth that are screwed in, don't come in and out. Let that patient smile and laugh and enjoy the time while they're healing before they get their final set. We don't want to put someone in dentures for 6 months while they heal up. We don't want someone to go without anything at all. Our goal is to have someone with teeth, so they come in and they leave with a new set of teeth. They come in with those teeth that are giving them pain, making them uncomfortable, or maybe anesthetic, and then they leave with that new set. So that's a big thing at our office, is making sure that everyone leaves with that new smile. I think one big thing for patients that honestly everyone is nervous of when they come in is, what are the risks of dental implant procedures, right? What possible things can go wrong? And in all honesty, it's biology. Things can go wrong, and I'm gonna kind of walk through those with you, kind of walk through what could go wrong and how they're fixed, and that they're not huge, big worries, right? So the first thing that can go wrong surgically is there might be some temporary numbness, there might be some bleeding after the surgery. All that can be completely normal and controlled by our office. Numbness almost always goes away. Bleeding normally stops with careful care. The kind of main thing that can go wrong in a dental implant procedure is an implant fails, right? An implant doesn't fuse to bone, and in those 6 months where you're healing, we notice that. The first thing is that that's not a catastrophe, right? Implants have a 95% success rate, but that means 5% of the time implants do fail, and it's not the end of the world. I use 3D dental x-rays to plan all my cases. We meticulously make sure that implants are placed in the best position, and I'm constantly thinking about, if something were to go wrong, what's the next step? I always have a plan for if an implant fails, and what happens is we place a new one in, you get new teeth sat right back on those implants, and we go through that healing process again. It's not the end of the world. With any big medical procedure like this, things can happen, but we're always here to help you fix them. When you're choosing an implant office, one of the big things you should look at is what are your final teeth made out of, right? There's a couple different options, and some offices will use different things. The traditional way dental implants were done is that the final prosthetic, the final teeth, was made of acrylic, the same thing that denture is made of. It's plastic. And they would make these acrylic teeth, and the acrylic teeth would screw into those implants. We don't do that anymore, but there's still some offices out there that make teeth that way. They're just not as strong. They tend to break after a little bit of time. The other thing to look at is there's a lot of offices that might have a cheaper price, but their final material is a temporary teeth. When you come to this office, you get temporary teeth for 3 to 4 months while you're healing up, and then we move you to those finals. Those temporary teeth are normally printed or a milled PMMA, which is like a plastic material again. And those teeth, they look really nice and they normally last for the whole time while you're healing, but after about a year or two, things start to stain, things can break. So a lot of times offices can give a cheaper price because you're not getting those final teeth made of the strongest material. You're kind of getting a halfway point. Here at our office, I don't like doing things in halfways. I don't like having people in temporary teeth for a long time. So our final material is a material called Zirconia, which is a really strong material to make teeth out of. Lets you chew what you want, lets you eat what you want. It's the most aesthetic of our materials. So we make those final teeth out of kind of the best thing possible, so people aren't kind of left in that halfway position. So that's just a big thing to look at when you're looking at different offices and comparing different places, is what is that final teeth made of? Because it could be a big difference.